Member for Wirrawar for this motion today. It's incredibly important to acknowledge International Pregnancy and Infant Loss Remembrance Day, which was last Friday, October the 15th. It's a day to recognise bereaved parents, families and friends, because let's be clear, it does actually affect a whole community. And to remember the babies they have lost through miscarriage, stillbirth and infant death. It's also a day to acknowledge those wonderful healthcare workers that provide support and wrap services around parents in their time of need. Mr Deputy Speaker, it is likely we all know someone who has been affected by pregnancy and infant loss, but we may not even know that they were affected. It is all too often a private grief. Even though Australia is one of the safest countries in the world for a baby to be born, still more than 2,000 babies are still born each year. Thousands of families suffer with the terrible experience of miscarriage every year. And Mr Deputy Speaker, I myself had a miscarriage between my third and fourth child, so I also know of the grief that people suffer. Sadly, 3 out of every 1,000 babies born in Australia every year die within the first month of life. For those families and parents who have suffered infant loss, either in pregnancy or around birth, the physical and psychological damage is traumatic and incredibly painful. As a doctor, I heard stories from women who've remained traumatised for decades following the callous way these issues were handled a generation ago. Now, I'm pleased to say this is no longer to the same extent, and a significant improvement in the way these issues are handled has really helped prevent the deep and ongoing emotional effects brought on by these tragedies. But still, too often, they can be overlooked and underestimated, and that's partly because of the privacy of the grief around these issues. The trauma of these events can trigger depression, anxiety, indeed relationship breakdowns, and even post-traumatic stress disorders. Mr Deputy Speaker, the Morrison government understands the significant impact that pregnancy and infant loss has on families, and that's why it is working in partnership with states and territories and a whole range of important organisations. It has also made significant commitment of funding to this important area. Last year, the Morrison government announced the National Stillbirth Action and Implementation Plan. This plan invests $152 million in perinatal services and support measures to improve health outcomes for babies and mothers. It includes $21 million in measures to reduce stillbirth and support families affected by stillbirth. Measures include education and awareness programs, developing a new clinical care standard and supporting research, so that we can always do better. This investment aims to reduce stillbirth rates in Australia by more than 20% by the end of 2025. Mr Speaker, the government recognises that preterm birth is a major cause of stillbirth and infant loss, and is providing $13 million to implement the Australian Preterm Birth Prevention Alliance's program to reduce the rate of preterm birth nationally. $43.9 million is also being invested in the Perinatal Mental Health and Wellbeing program, providing support for families experiencing grief following the death of a child, including as a result of stillbirth. To ensure intensive support is available to families experiencing stillbirth, the government is also investing in Red Nose to deliver the hospital-to-home program, and has announced an additional $400,000 to ensure the program continues for an additional 6 months. We all know that sometimes it's hard when you have to leave home when you're dealing with grief and bereavement, so it's wonderful to hear that these outreach services are going into the home to support families at their time of need. Mr Deputy Speaker, I was proud to be part of this government and to speak in support of the Fair Work Amendment improving unpaid parental leave for parents of stillborn babies and other measures bill last year. This bill amended the unpaid parental leave provisions and complemented the government-funded paid parental leave pay changes. It provided for the same entitlements of unpaid parental leave as if they would have if their baby had survived. And this has really helped parents who are grieving because, as again I said, this grief can be so private. It's a time that enables people to be with their family, their friends and their support system. It's a time not only to grieve but also to arrange funerals, to be together with those you love and whom you love. Mr Deputy Speaker, in my first speech I said the words widow and orphan describe loss in our language, but no word exists for a parent who has lost a child. Wouldn't it be wonderful if we could eliminate the devastation of infant loss? I commend this bill to the House. Thank you, Mr Speaker.
Thank you, Member for Higgins. There being no further speakers, the debate is adjourned and the resumption of the debate will be made in order for the